Hi guys, my name is Natasha binti Muhammad Zain. My metric number 070392.
My name is Nunadira Asila binti Muhammad Zamri, number metric 069085.
So today we're gonna to present about.
Antenatal problems and physiotherapy management.
So enjoy, let's start!
One of the most common complaints during pregnancy is back pain. Most back pain is related to the physical changes that happen during pregnancy, including hormones, changes in the gravity and posture.
Assalamualaikum, doktor.
Awak apa masalah awak dan saya ini?
Doktor, kebelakangan ni saya punya badan macam sakit lah belakang ni. Saya tak tahu kenapa.
Nampak cerah tu pun dah salah dah. Nanti saya akan ada awak cara posture yang betul. Lepas tu kita akan tambah dengan sensory exercise dan stretching exercise. Awak nak buat hari ni free atau nak kita pergi ke hari lain?
Pagi ni saya free macam ni. Boleh lah.
Okey, kita dah boleh buat sekarang?
Boleh.
Okey, jom.
Jom.
I will teach you about how to do strengthening exercise. Then we need to do squat, and then you need but the squat is you need to hold like this. Hold for 10 seconds. Next, I will teach you about stretching exercise. First, straight your leg, and then put your leg like this, and then your hand just, and then twist your body. This is for stretching exercise. The exercise need to hold for 50 seconds. So then, the first thing I will teach you is about your right standing posture. First, open your chest, press your shoulder, and then straighten your back. Okay. And then your feet must have a space like I. This is the right standing posture for pregnant women. I will teach you about right posture of sitting. Okay. First thing you must do is put the pillow behind your back, and then you must straighten your back, and then the second pillow must be put below your feet to support your waist. Then this is the right posture of sitting. Next, I will teach you about the right posture from sitting to lying. First, you must raise your leg. And then like a foot. Then you can face your side and bend your knee. Put the pillow behind your leg, and then the second pillow at your back. Support your weight.
Another management is back pain massage. Take note all these pregnancy massage reminders.
Just sitting on my kitchen chair. You can use a dining room chair, any chair that doesn't have any armrests and that's comfortable for your partner to straddle. And I'm going to do a nice long nerve stroke starting at the top of her neck and all the way down to the sacrum. And about 10 of these, maybe 12, just to get mom relaxed. Okay, now we're going to start with the hips. I'm going to start with my fists, just leaning in at the hip bone area. First, I'm actually going to start down at the buttocks. And you can see that I'm kneeling. I've got one knee up and one knee down. That gives me stability. And I'm just going to move. I'm just going to use my body weight. It takes the strain off of you, the partner. How does that feel?
That feels good.
Is that about right?
Yes.
Okay, great. Okay, so I'm just keeping a straightish arm. And as I move inward, my elbows go out a little bit. I just want to relax with this, and I actually want to breathe with Amanda. So take a nice deep breath in, and then I'm going to press in as she exhales. And then I'm following her rhythm. If she breathes in, and I'm going to press in. You're just sort of gently rising so that by the time you get up toward her shoulders, you'll be standing and leaning in. Okay, and then I will just finish with nerve strokes again.
Pelvic girdle pain is pain in the front and the back of your pelvis that can also affect other areas such as the hips or thighs. It can affect the sacroiliac joints at the back and the symphysis pubis joint at the front. This stretching to reduce pelvic girdle pain. So the name is pelvic tilt. Sit upright on a firm surface with your feet hip width apart. Keep your upper body and shoulders still throughout this exercise. Arch your lower back to tilt your hips and pelvis forward and backward. Antenatal depression can be caused by a hormonal imbalance. Although, because all women experience hormonal changes when they are pregnant, that's unlikely to be the only cause. Other things that may play a part are previous miscarriage or difficult birth experience. So, the management for depression is yoga. This first yoga is for first trimester, and first you need to extend your right leg, and then your left leg must be close to the body, and then your body must be straight back, and then stretch your hand above your hip, and then hold for 50 seconds. So this yoga for second trimester, you need to place your leg like this, and then place your hand like this and lie on the pillow, and hold for 50 seconds. So today I will teach you about yoga, and this yoga for third trimester. Okay, so first you need to jangkung like this, and your hand must stretch your knee, and then hold for 50 seconds.
Next, we move to breathing pattern. Benefits of practice breathing pattern is it making contraction more productive, dealing with life everyday stresses, and sharpen your focus, and also provide more oxygen for your baby, muscle, and uterus. First is he blue breathing.
Okay, let's do it together. So you want to be relaxed. Remember, you're expanding your tummy as you inhale and exhaling through your mouth all of that tension. So let's do this together. Inhale, exhale.
Next is he breathing.
Out of active labor and you are now in transition. And transition is the hardest part of labor, but it's also the shortest. So they are coming fast and they are coming hard. And so breathing manually is going to be really, really important for you. So I want to teach you a type of breathing that is going to help you avoid pushing and resisting that urge. So this breath is just a short, shallow one. So that's the kind of breath that you want to be doing. You might be thinking, that sounds kind of like you're hyperventilating, but it's not. Hyperventilating is like you're taking 2 shallow but purposeful breaths in and 2 shallow but purposeful breaths out.
Last is J breathing.
All right, let's do the breath together. Okay, let's breathe in and out. Okay, I know that breath sounded a little bit funny, like I was mooing, but that's a good sound to be making. And if you do that consistently through those contractions at the end as you're pushing, you are going to have an easier delivery as you are breathing your baby out instead of holding your breath and bearing down.
Another problem is edema and cramp. To overcome this problem, therapists can do foot circling and plantar flexion stretching.
Hi guys, so today I will show you how to reduce the cramp and edema. Assalamualaikum Puan. Kenapa Puan datang ke departmen kami hari ni? Ada masalah apa?
Kaki saya bengkak dengan kram.
Oh, masalah bengkak dengan kram ni memang normal untuk perempuan yang mengandung. Ni disebabkan ada accumulation of fluid dalam tempat kaki ni lah. Okey, jadi saya akan ajarkan beberapa teknik untuk kita kurangkan edema dengan kram puan ni. Okay, first of all, you need a pillow and put the pillow below the patient foot. Okay, make sure the leg is slightly higher from the bed to smooth the blood circulation. First of all, you just have to put your palm below the patient foot like this and do the dorsiflexion for the patient like this. Next, the second technique is foot circumduction. So I teach you guys. Make sure the patient foot is hanging like this and just ask patient to roll the foot like this for 15 times per session, and she can do at home. This can reduce the edema because increases of blood circulation.
Next is incontinence problem.
Okay Puan, selain daripada masalah kram ni, ada masalah lain ke?
Saya tak boleh nak kontrol kencing.
Oh, masalah tak boleh kontrol kencing tu pun masalah common untuk ibu-ibu mengandung. Jadi saya akan ajar teknik untuk Puan cuba amalkan supaya kita dapat kontrol balik bladder Puan lah. This technique is you can just ask the patient to try hold their pee. Okay, patient. So I will touch a little bit right here. So Puan, cuba tahan macam kita nak tahan kencing tu. Okay. Okay, saya dapat rasa lah.
Hai.
Okay. Okay, lagi sekali. Alright. Okay Puan, so saya harap Puan amalkan apa yang saya ajar tadi dekat rumah lah, sebab tu semua Puan boleh buat sendiri dekat rumah. So Puan, tamatlah sesi kita pada hari ni. So, jom kita balik. Bye! That's all from us. Thank you for watching. Bye!